In this lecture, we're just going to cover some things that can go wrong with the nervous system that are more specific to children. Children are a little bit different than adults. They're growing faster. They are not exposed to environmental hazards as much. Of course, a child can fall and break their back. So there are things like that can happen. But it's more likely to be a congenital problem, something that maybe started in utero and developed early than a late developing tumor or something that might affect an adult. So first of all, they grow from the ectoderm. Their neural plate has to grow from almost nothing into a little plate which curls around, makes a tube, forms, a blob on the end that's going to become a brain, forms the spinal cord, branches out, forms the nerves. So during that development time, there are things that can go wrong. Proliferation of the neurons, the migration down into the developing arms and legs. They have to myelinate all of the nerves that are supposed to be myelinated. So specialized cells are transformed into Schwann cells, oligodendrocytes, and the like. Third, fourth, and fifth gestational months is when the brain develops quite a bit. And so during this time, if the mother is drinking a lot of alcohol, smoking a lot of cigarettes, taking other kinds of drugs, there's a real chance for some neural defects to happen while these very fast-growing nerve cells are differentiating and growing into what they're supposed to be. Growth abnormalities are very common with poor maternal health. Taking of drugs, drinking alcohol, insufficient diet, particularly folic acid, folate, is required for the neural tube to close properly. And so neural tube defects will happen in parents with deficiencies, particularly in folate. Oxygen levels, if something happens to the mother that reduces oxygen temporarily, it affects the baby as well. Infectious diseases, HIV, a variety of things can happen to the mother that will affect the growing fetus. The neonatal responses, you have the Babinski sign, you tickle the bottom of their foot and they're supposed to do this and they're supposed to do that and they're supposed to, have these certain responses that you'll learn in your medical programs. And those responses should occur and disappear at the right time if the nervous system is growing correctly. Most of the baby responses should not happen in an adult because the nervous system has changed from fetus to infant to adult, and so watching the progression of those responses can help you tell if it's developing right or not. Furthermore, the brain case. It is in a bunch of little separate bones during fetalhood and during childbirth. A vaginal birth often produces a child who has sort of a cone head. It is able to go through the birth canal and then reshape itself in a relatively short time into a normal shaped baby's head. It's the only way a baby's head can come through a birth canal, is to be somewhat soft and movable. The fontanelle here, this is the soft spot on the baby's head. When they're that young, it's susceptible to damage because there's really no skull protecting the brain. Anencephaly, these are some defects. Well, that's a pretty big one. Anencephaly, born with no brain. No brain. They can become politicians. Anencephaly. Encephalocele. A cele, C-E-L-E, means hernia. Anything that's herniated, bulging out, is a something-ocele. And so encephalocele means a brain herniation. It's sticking out through some part of the skull. Meningocele, a herniation of the meninges. And a myelomeningocele, if you remember, myelo means spinal cord or center. Myelomeningocele means spinal cord meningeal hernia or spina bifida, where the meninges actually extends outside the baby's body and contains some of your spinal cord. Spina bifida, meningomyocele, bulging out through the skin. Parts of the nerves are actually in there. This is down around the area of the cauda equina in this case, and therefore they're individual nerves. It can be surgically repaired, but these nerves, they're the wrong length. You can't just shove those back in and have them work exactly the way they were supposed to. Most kids with a spina bifida of this degree have some degree of dysfunction, paralysis, or something afterward. You can be born without a skull. You have a brain, but you don't have a skull, in which case you have to have some kind of a protective device created for the brain. Hydrocephalus, if you're born without the ability for the fluid to drain properly, the pressure inside the head increases because of fluid in there, water on the brain. Microcephaly is a condition where the brain is unusually small, the skull is unusually small, the children are profoundly retarded, generally speaking, requiring a lifetime of care. Zika virus is causing huge numbers of microcephaly kids to be born. And especially in Brazil, it's shown up a lot, but other parts of Central and South America and the Caribbean where Zika virus is endemic. Other malformations just give the child a funny shaped head. That's not so good, but it doesn't necessarily mean the brain won't work. And you don't have to memorize these. You know, you can have elongated, you can have flattened. Every baby's skull looks like an alien of some kind. Just my opinion. Babies are cute, but their skulls, whoa. Cerebral palsy. Encephalopathy means some kind of disease or pathological condition of the brain. Cerebral palsy is damage to the brain and brain stem, usually not the spinal cord, but the brain and brain stem, which leads to a lack of or improper signals making it out of the brain. It can be caused by a kid being born with their umbilical cord around their neck and blocks off their blood to their brain. You know, a kid that doesn't start breathing soon enough, it can be that. But most cerebral palsies, nobody knows why they happened. And often you don't know that the kid has cerebral palsy until they're, you know, at least a year old or more, because they don't have any normal movements much before then anyway. And so it's hard, especially to tell, you know, retrospectively 2 years before, what might have happened to cause the cerebral palsy. Spasticity and rigidity or tightening of the muscles. Dystonia means improper amount of movement, too much muscle activity or too little. You know, hypertonia, myotonia. And ataxic means you know, an inability to perform functions in a normal way. An ataxic gait is kind of a staggering gait, or maybe a spastic type of gait. Some of the kids can be quite bright, but can't express themselves very well. And kids tend to have seizures. Epilepsy, if you remember, it's because it's not caused by something else. They can have epilepsy because they have a brain tumor. They can have epilepsy if they are dropped on the floor and bash their head. I mean, not epilepsy, but a seizure. Or they can just have seizures. Sometimes they grow out of them. Sometimes they can be treated and prevented. Juvenile myoclonic epilepsy. You know, that by definition means probably you don't have it anymore when you're 30. And fevers. Children can tolerate higher fevers than adults, and so it's not that uncommon for them to have fevers of 103, 104, even 105, and survive them without brain damage. But fevers that high cause nerves to misfire, and the child can go into seizures because of the fever. Febrile means fever. Acute, something that happens to them right now. A couple of them, lead poisoning, intoxications, mercury poisoning, things like that can cause them to become extremely violently sick. Meningitis, bacterial and viral. Kids get a lot of ear infections, and that's an easy way for viruses and bacteria to make it into the central nervous system and cause meningitis. And Reye syndrome, fortunately, is quite rare, and it's actually not known what it is or what causes it exactly, but it is an inflammation of the brain, dysfunction of the nervous system that is linked to giving aspirin to young kids. And that's why most kids get Tylenol. Tylenol can be bad if you're an adult and you like to have a couple of drinks in the evening, because Tylenol and alcohol can cause liver failure. But most kids don't drink alcohol. So that may be a better choice, even though it's rare. Most kids who have aspirin have no problem at all, but it is linked to giving aspirin to young kids and bringing on this drug-induced encephalopathy. Tumors, they can have any tumor that anybody else has, but remember, most childhood tumors are sarcomas. They're connective tissue or muscle, but kids do have a variety of cerebral tumors. They can be glioblastomas. They can be neuromas. So brainstem gliomas, astrocytomas. Remember, astrocytes are some of those cells kind of like oligodendrocytes that help hold the cells together in the brain. We know that neuroblastomas are a possibility. That's just an overgrowth of a nerve. Retinoblastomas are one of the more common childhood tumors. Even though it's not a sarcoma, it is kind of a neuroma, but it's on the retina and grows in the back of the eye, generally causing blindness, maybe having to have the eye removed. Here's a neuroblastoma. Sometimes kids will get these, they're, in utero. They have them by the time that they're born sometimes, or very shortly thereafter. A cancerous growth of nerve cells, most commonly in the adrenal glands, sometimes in a variety of other places, in the neck, the spine, and whatever, but here is a neuroblastoma on an adrenal gland on top of the kidney. Childhood neuro problems. Now we get to move on to the cardiovascular system.